Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Well, we have a really great interview that is going to be in partnership with Crest Oral-B. We have Stephanie Gans here with us today. I'm super excited to learn from you, and we're going to tackle a really interesting topic that I think a lot of people like to talk about with their patients. We're going to talk about shouldn't we all use an electric toothbrush and the benefits of oscillating, rotating technology. Welcome to the podcast.
Thank you so much for having me.
I should say Dr. Stephanie Gans. Yeah. Sorry, my apologies.
I remembered in an email, Stephanie and I back and forth, I was like, doctor. She's like, don't call me doctor. And I'm like, but I have to.
I'm like, just Stephanie is fine.
Andrew has a problem. And then I have the opposite, and I'm not super formal. So my apologies, because you are Dr. Stephanie Gans.
I'm the same way. I'm not super formal. And then you're like, oh, I might need to kick it up a notch. But yeah, just Stephanie is great. Thank you guys so much for having me. I'm excited to be here and talk a little bit about toothbrushes and electric toothbrushes specifically.
Yeah.
Well, welcome.
Do you mind starting off by just giving our listeners a little bit of background, who you are, where you're coming from, so they can get to know you a little bit better?
Sure. So my name's Stephanie Gans. I graduated from The Ohio State University's College of Dentistry in 2013. I practiced dentistry for 5 years in my hometown of Cleveland, Ohio. And in fall of 2018, I moved to Cincinnati to work full-time for Procter & Gamble.
So let's get into this topic. So is there some evidence-based research on the electric toothbrush being superior to a manual toothbrush?
Yeah, there's so much great research out there. So the first piece of evidence that I think it's important for people to know about is the Cochrane Systematic Review. So Cochrane is a third-party company, and what they were able to do is they were able to evaluate the performance of electric toothbrushes versus manual, as well as compare electric to electric toothbrushes, so different types of technology. And what they were able to find is that people that were using an electric toothbrush reduced their plaque and gingivitis more than people that used a manual, and also more than people that use sonic technology versus oscillation rotation. In addition to Cochrane, there was also another study that was released by the University of Greifswald, which is in Germany. And what they were able to find, it was actually an 11-year study. So they were able to find that people who used electric toothbrush had 20% less tooth loss than manual users. So Andrew, if I said you could suffer from 20% less tooth loss if you just use this toothbrush, wouldn't you be so excited to use it?
So obviously, yes. If it was that easy as something so simple as an electric toothbrush, yes, I would absolutely. But I feel like there's still some hesitation though with our patient bases, and I would wonder what would be causing that.
There's just so many reasons, I think, why patients are hesitant to switch. A lot of people sort of have that old adage of if it ain't broken, don't fix it. Mm-hmm. They've been using a manual forever, say they haven't been having a lot of issues, so they're comfortable with it. But I think, so they don't think that it's necessary. But I think what we can do as dental professionals is we can share the research and we can talk to patients and really explain how an electric rechargeable toothbrush is going to reduce plaque. It's going to reduce gingivitis. And as we've learned from the 11-year study is that it's going to prevent problems in the future. And I think there's some other hesitations that people have. It could be the price too. It is an investment. So what dental professionals can do is there's a program called Test Drive, which is a way that patients can try an electric rechargeable toothbrush in the chair. So the hygienist or dentist can show them how to use it properly and how to brush properly. And it's a way to try it, try before you buy. So it's like if you were buying a car, you wouldn't go out and just buy a car randomly without trying it first. And it's the same thing with an electric rechargeable toothbrush. If someone has just seen it on the shelves and never been able to try it personally, it's kind of a big ask to say, spend all this money on a brush you've never tried. So I think that's really helpful.
What about in this day though, COVID's a thing. And so how have you guys adjusted to the test drive with COVID?
That's a great question. So with the test drive with COVID, so even prior to COVID, the handle could be completely disinfected between patients. There's a sleeve on it. There's an entire disinfection procedure. And then the brush heads get thrown away, obviously per use. And the brush heads are designed in such a way that they cannot be used on our regular handles. They have a special rim around them to prevent any liquids or anything from getting inside of them.
Nice.
So very safe to use, you can completely disinfect it.
Love that. One thing I've heard though from some of my patients though, and I've actually even heard hygienists say this about how harsh sometimes they think that an electric brush could be.
Yeah, I think that's a common misconception. I think people, for a lot of people, they're used to using a manual brush. So they're used to kind of like scrubbing their teeth. So they try to replicate that same motion with a power brush, which isn't necessary. And I think the sound gets to a lot of people. A lot of electric rechargeable brushes, it can be a gear system on the inside. And anytime that you have gears sort of rubbing against each other or moving against each other, there's going to be friction, and that's going to create noise. And I think people perceive that as being too harsh when really it's just, how the motor works inside of it. A car makes noise when they're working. It's just pieces and parts working against each other. But there are a lot of studies to show that using electric rechargeable toothbrush is completely safe. There was actually a 3-year study that was completed that showed they looked at recession and abrasion, and they did not see a significant difference in recession and abrasion for those who were using electric rechargeable toothbrush and those who were using manual, which is really powerful. Mm-hmm. And also, the newest brush in oscillation rotation has what we call a bimodal pressure sensor, so a smart pressure sensor. So it'll show you, one, if you're brushing too hard. So if you're pressing too hard, it'll turn red to tell you to stop. It'll also turn green when you're brushing with the right amount of pressure. So it's just that positive reinforcement of, for you to keep brushing with the right amount of pressure. So green if you're brushing well.
Can I tell you, though, I totally didn't read the instructions when I tried it, and I was telling Michelle about it. And I was like, oh, look, it's like not quite almost there. And then finally you're there. And I'm like, oh, that's not what those lights mean at all. Do you remember me telling you that, Michelle? I'm like, oh, there's different lights.
Absolutely do.
And I'm like, oh my gosh.
Big shocker. Andrew didn't read the instructions for you.
I think I'm more worried about your driving skills now. Like, red means stop.
No, you should be. You should be. Because yellow means go faster. And then, right?
Oh, boy.
How that works? Red,
well, you did
yellow.
move to Florida, so this seems fitting. It makes sense now.
Look, as just a quick side note, I know no one cares about this, but I was going 65 in a 60 mile an hour zone here in Florida, and everyone was passing me going 90, and no one was getting pulled over. So
exactly, I'm just saying it fits very well that you've moved to Florida, and
you're gonna fit right in.
Oh, yeah, sure,
for sure. And what I enjoy so I'm big with oral hygiene instructions, like. That's the biggest part of my appointment. Especially when I'm following like guided biofilm therapy, that is the first thing after my assessment. So I think it's super important to have products in the office that allow you to demonstrate right then and there. There's been a lot of things that I have learned about how patients translate. I just think it's super important to have that device that you're going to recommend. And I have personally learned a ton about how patients translate what I'm telling them. I've had patients use interdental brushes like a toothbrush. They're like, but that's how you taught me to use it. I'm like, oh no.
You're like, that's not what I said.
Okay. So I see now we're going to have to do actual demonstration, tell, show, do kind of thing. That way. And the same would go with an electric toothbrush. So I think it's fantastic that we do have that option.
It's weird, I think, for me being a 30-something-year-old telling a 50-something-year-old, anybody, male or female, how to brush their teeth, right? Like that's a thing that I can watch them do it. I can tell them how to do it. I can watch them do it, blah, blah, blah. But I think having a third party or objective or whatever you want to call it, something else that's telling them, they pay more attention to that, I think, than sometimes the words that I say or the inflection that I use in my voice. So I would agree.
Oh, definitely.
Well, and I think the studies that you brought up too, that's always been my third party, right? So, it's not me saying X, Y, and Z. We have new data. We have new evidence-based research. We have new literature out that tells me X, Y, or Z. And I think instead of it being like, me or the dentist, like, oh, well, you just want to pay for your beach house or your BMW. I'm like, no, this is we've just discovered a new study or which I would love to talk more about the studies if we could.
Yeah, absolutely.
Because I think that is a great thing to have like in your back pocket when you are having that conversation with your patients about oral hygiene instructions and which products you choose.
Yeah, I think so. A good place to start there is if you can look at the hierarchy of evidence. So for research, so it's basically a pyramid structure, if you can imagine that in your mind's eye. So I think for a lot of dental professionals, they're thinking to themselves, well, if I recommend this brush or if I recommend this treatment, how's the patient going to look when they come back and sit in my chair? So like, what's the clinical relevance of this recommendation that I'm making? And I think one way to look at that is to look at this hierarchy of evidence. So if you think of a pyramid and you think at the bottom, that's basically animal and lab studies, which is a great place to start, but it has pretty low clinical relevance. And as you work your way up the pyramid towards the top, the higher the clinical relevance. So the second to the top tier is where randomized control trials sit, which is what a lot of the studies are. So if we look at like plaque and gingivitis studies, those are usually them, like 6 to 8 week studies looking at those endpoints. And the tippy top of the pyramid are systematic reviews and meta-analysis, which is basically saying, so say I had 10 people looking at plaque and gingivitis, and they all had their own conclusions. And the meta-analysis is a statistical way of putting all of that data together. So, we take all of the studies, put them together to come up with one main conclusion. And that's exactly what was published actually just this past year in 2020 in a meta-analysis that was published. They were able to take a look at plaque and gingivitis endpoints for oscillation rotation versus sonic brushes and versus manual brushes. So it's pretty strong evidence that you can share with your patients. One other reason why it's so clinically relevant is that the data that they had, they were able to have the individual subject matter data. So what they were able to look at is they were able to take Jenny on day one and Jenny at the end of the study and see how they improved. So, if she had gingivitis on day one, they're able to look at, after 6 to 8 weeks, was she healthier? Was the plaque reduced? Was the gingivitis getting better? And now with the 2017 guidelines, we have sort of that structure to say, she has less than 10% bleeding sites in her mouth. She is considered healthy. So we're able to see that transition from general gingivitis to oral health.
And I'm just curious, when with that study, was the control the lights and the technology that helped the patient understand if they were using the correct technique? Or was there a little bit more guidance from the dental professional?
So it's tough because there are so many patients, so you can't really, go home and follow them. And it was since it was a meta-analysis, these studies were all conducted separately. So they were just finding a way to bring in the data together. So it may have been a little variable in terms of what kind of guidance they were getting from the dental professional.
Yeah, because I think that's a very important distinction from all the reviews that I have read was if it is better than a manual, you really got to teach the patient to change up their technique.
Oh, definitely.
Because, and how often do you see this, Andrew? Like the patient puts their brush in their mouth and they're just bebopping top, bottom, left, right, inside, outside. And you have to teach them that there is very much a different technique when it comes to using electric toothbrushes, and they should clean up their manual toothbrushing technique anyway.
Totally.
Yeah.
That's besides the point.
I know this isn't necessarily on your outline, but I would love to talk a little bit about that technique a little bit. Like, what are the key ideas that we have to be thinking about as we're teaching these patients, and what are some of the tools that's kind of built into the technology to help us teach the patients?
Thankfully, there's so much great technology out there. So with the newest oscillation rotating brush, it's a small round brush head, and it really conforms to that the tooth anatomy. So really the way I explain it to patients is to just go tooth by tooth, do the buccal surface, do the occlusal surface, do the lingual surface for each tooth. And the way that the toothbrush is structured, the brush head, is that it'll really get into those interproximal spaces, those embrasure spaces, and really get an excellent clean. And then some of the features that are built in really help people their compliance gets so much better. So for example, we all know that people are supposed to brush for 2 minutes, but how many of your patients actually do? Probably not as many as they should. So built into the brush is a timer that'll buzz at every 30 seconds so you know to move to the next quadrant. And the timer, there's actually an LCD screen right on the front. So you can watch the time. And even as a dentist, like I don't even realize that sometimes I'm not brushing for enough time. And then you watch it and you're like, oh, it's only been a minute and 20 seconds. You're like, I guess I have 40 seconds to keep brushing my teeth. Like I should really keep going. Like I feel like you feel bad for cheating because you see the time right there and you're like, just get it done for 2 minutes. And so it reminds you to do all of the quadrants for the right amount of time. We're talking with the pressure sensor. So you know that you're brushing with the right amount of pressure.
There's an app or something too, right?
Yes. So what's also great about it is that you can connect it via Bluetooth to an app on your phone. And there's a program on there called position detection. So I think what I've noticed is that there's usually one area that people miss consistently. Like for some reason, if you're right-handed, you seem to miss like the right side of your mouth more. And with position detection, it actually has up to 16 different zones to show you where you should be brushing. So the areas that you missed, and it'll actually give you a score of how well you were brushing, all the areas that you got. So it makes sure, the compliance is it helps you brush for the right amount of time with the right amount of pressure in all the areas that you need to. So you really get the best clean possible. You make the most out of your 2 minutes.
I love that.
Yeah. So it's really great. And we all know, Andrew knows this now, that red means stop. So green means you're using the right amount of pressure, and red means that you're brushing too hard. And I think my favorite thing is on the newer brush, you actually have a smiley face. So if you brush, say you brush for like, it's amazing how like motivating it is for like even a grown adult. Like you would think that would be more for like children for their sort of compliance and motivation. Yeah. But if you do it at like a minute and 50 seconds, it gives you this like meh face, like I'm disappointed in you. You could have tried harder. It just makes you want to finish up those 2 minutes because then it gives you a smiley face and it winks at you and you're just proud of yourself. So I think that really helps
kind of triggering that reward center in the brain.
Totally.
I'm still a child enough that does make me happy. I'm like, okay, smiley face.
I wish I could like upload a picture of my mom. Like if it was my mom looking disappointed, you'd be like, wow, I really got to brush better.
You know what else is interesting though, too? I know this is just like going back to the basic levels of how our brains work, but things like good morning or good evening, or, these little messages that get hello, like those types of things that get told to you. I don't know. It's just like a welcome feature. It's like when your fridge does like, well, good evening, Andrew. It is 34 degrees outside in Portland, Oregon. I'm like, thank you, fridge. I wanted to know how cold it was outside.
I know. I love that my brush will say like good morning and good evening, and it'll smile at you, and it just almost like personifies it in a way, sort of like, your smart device. If you say like good night, it responds back.
I feel like Michelle talks to her phone like that.
I do not say nice things to my phone, so no.
Do you say please and thank you to your...
I tell Siri how horrible she is on a regular basis. So I'm not kind to my person that is my phone.
Well, okay. So speaking of this, I don't actually talk to my phone because I feel like I'm too old to be cool enough to have got that part of technology. But going back to brushes though, do you feel like there is sometimes like a hindrance that people are like, well, that's just too newfangled technology. That's never going to work for me. Like that's for the kids to use.
I think there is some hesitation. So, you don't have to go from like 0 to 100, all at once. If you say you're a manual brush user and you've been using it your whole life, there's a whole array of oscillating, rotating brushes that you can try. So if you just want, a basic model, you're going to get an excellent clean. It may not say good morning, but your teeth will be clean. You'll be brushing for 2 minutes. You'll get an excellent clean, and then you can work your way up. And even if you have, the highest level brush, you don't have to use the app with it unless you want to. So it'll actually store the data if you're interested. It'll store like so many brushing sessions. So you can always go back and check and see how you did, but you don't have to use position detection if you don't want to.
I say, so for me, like I generally try and tailor specific types of brushes for my patients, right? So if they have a hard to reach area, then there's different sizes and shapes of brushes, different, soft, softer, extra soft. How does that roll in with electric brushing?
So that's a great point. So there's so many different brush heads that go with the electric toothbrush. So say you have like a fixed retainer that you've had because you wouldn't wear the one you were supposed to. So your mother made you get this. So there's all sorts of different brush heads. So there's one that's interproximal, which is small and narrow. So you can clean around smaller areas. Say you have a fixed prosthesis, you can use it to clean under it. You can use it to clean around implants. There's also bracket brush heads. There's sensitive brush heads where the filaments are crimped, almost like 90s hairstyle. Michelle, I'm sure you remember.
Did you rock it, Michelle? The little crimped hairstyle?
I still have a crimper and I am not ashamed of it. Okay.
Wow.
Yeah. She's not afraid to use it.
Okay.
So
I'm waiting for the trend to come back. I feel like we're getting
you're
close.
totally getting close. I think you could bring it back
around.
yourself.
Oh, be ahead of the curve.
Thank you, Stephanie.
Start
Thank you.
that trend.
Thank you.
So the filaments are
That is
crimped. So, when they move around, it's just a little bit more of a gentle experience when you're brushing.
So is this still oscillation rotation with these different brush heads?
Yep. So they have one that'll clean around brackets really nicely. The interproximal will get underneath and around, prostheses really nicely. There's ones that are a little bit more gentle. So if you're a little bit more sensitive. So pretty much a brush head for everybody's special needs.
Excellent.
So speaking of special needs, I'm curious, do you have anybody out there using the test drive option for like nursing facilities? Like if I were to go around and as a caregiver or as somebody doing oral hygiene for others, so now it's not so much a product to
like teach
demo, but actually use it to aid in oral hygiene, because it does I didn't realize there was a different kind of tip so that you can't cross-contaminate as much. I mean, that just seems like a great thing for that particular caregiver side of it.
I don't know specifically about it being used like in nursing homes, but I think it's an excellent idea. It doesn't produce aerosols. It gives you an excellent clean. It can be disinfected. So I think that's a great idea. I don't know if it specifically being used that way, but it probably could.
I feel like there's
I'm thinking even like a school-based program. I mean, there's just so many opportunities just to educate and also do home care. I'm thinking like somebody like Angie Stone or Sonia Dunbar going out into these nursing long-term care facilities, rehab facilities where, I was major surgery last year. Somebody would just come and give me a toothbrush in the bed. That would have been fantastic.
And you could tailor it very specifically to each of the patients too. What are the different tips and I feel like there's also a partnership that we could create with some of the hospital staff, nursing staff, whoever, and educate them a little bit more too.
I think that's an excellent idea. We'll have to discuss that further.
For sure. But there's just so many opportunities because home care is the ultimate biofilm management, protocol that we need to be embracing. It's kind of like going to the cardiologist and getting the stent placed and then eating McDonald's afterward.
Right.
That's your reward. You got the thing done. It's fine.
We used to go get milkshakes after the orthodontist, but that was because all of our teeth were so sore.
I 100% did the same. Frosties, Wendy's Frosties. Oh, yeah. 100%.
It's like from the orthodontist to the drive-through.
100%.
I think, for a lot of patients, they'll get dental treatment done and they need to have a great way of when they leave the office to take care of it. I think, one, it's great for the patient, and two, it's great for the office. I'm sure you've had situations where, a restoration was placed or an implant was placed and the patient didn't take care of it and it failed. And that's frustrating for all parties involved. So it's really important that they have the tools that they need to take care of their dental treatment at home. So for example, say if you've just had an implant placed, there are kits available that come with all of the tools available needed to take care of an implant. So the manual brush for right when it's been placed, the rinse, the power brush with all the different tips available to be able to clean around it properly. And especially like the special types of floss. So it's a really nice way to be able to communicate with your patient what needs to be done and make sure that they are getting all of those tools when they get home.
And I do know at one point there was a moment where people were questioning using any kind of electric device around an implant. But we understand now that that's not, unless anything has changed that I missed.
It's perfectly safe to use electric toothbrush around an implant. I mean, they should follow the recommendations from their dental professional. Obviously, when it's first in place, they'll use a manual brush while things are healing. But once things are, osteo integrated, they can move to an electric rechargeable brush.
Is there anyone that shouldn't use an electric toothbrush?
No, I mean, I think one of the questions we get a lot are about pacemakers, but if there's any sort of question, they can always double check with their medical professional. Usually the guidance is to keep it about 6 inches away from the pacemaker, and you can turn off any Bluetooth functionality if there's any concern about that interfering. But yeah, if there's any sort of questions or concerns, definitely check with your medical professional.
And what's the age range for electric toothbrushes?
So we actually have electric toothbrushes that are geared towards ages 3 and up. So we have some cute designs on them. So it's great at a younger age to be able to start kids on electric toothbrush, showing them how it's used. It's great for oral health, and starting them young.
I feel like that's the time to get them to start, because they're going to be a little bit not as super compliant. It tickles, right? It tickles at first. It might be a little bit interesting. Then you get to, ages 5, 6, 7, depending on when they're starting to lose their first teeth. And you get that little bit of irritation in the gum line as those first teeth falling out. I think the problem that I see, and this is just Andrew's opinion on life, but the problem I think that we have with people not really focusing as much on those lower anteriors, in addition to all the other reasons that we keep telling them, is because as they've lost those teeth, they shy away from them as the parents are like, hey, by the way, you're brushing your teeth now at 4 years old. We're not going to supervise you anymore. Keep going. Then they're in pain when those teeth are lost, and they're not focusing on those lower anteriors any longer. And then they just get out of that really good habit of keeping those areas clean. So I feel like if there's a way to integrate, the power brushing at an early age, it's not that bad of an idea.
And I think there's a great way with parents too, to sort of introduce them to the concept of tell, show, do. So for example, one of my young cousins, she's 3.5. And so we want her to start using a power brush, because her twin cousins are both dentists. So she will have perfect teeth. And, just like we do in the office with, polishing or showing little ones a polishing cup, we tell them what it is. We show them on their fingernail, what it's going to do, what it's going to feel like, and go from there. So I think explaining that to parents, when you get home, this is how you'll explain it. This is how you'll show it to them. You can get a power brush too. And while, little Susie's brushing, you can be brushing as well. Or you can go and then she can go. It's just a nice way to introduce it and to help kids with that transition into using a power brush. There's also a lot of great timers, like apps that are meant for kids too. Like there's the magic timer that you can use that'll play music or, show you images to help kids brush for the right amount of time.
So also one thing that my kids have listened to this before, we're all about podcasting here. Obviously this is a podcast. There is actually a podcast that's put out by Gimlet Media, who we love, Gimlet Media, and it's actually Crest Oral-B is affiliated with it, and it's called Chompers. It's a 2-minute podcast for brushing. It's fantastic. It's amazing. They do new episodes all the time, but it's definitely geared for kids.
Oh, that's awesome. I'll have to check that out more.
That's very cool. I also think what I enjoy about electric devices is identifying the pushback from patients as far as vibrating. It tickles. I can't handle it. I can't tolerate it. I think this is where you can bring in any myofunctional therapy work or certification that you've done, because to me, that tells me that there's some other things that I need to investigate. If they can't bring their lip down and because they're curling that mentalis muscle, I'm going to look at some other habits that they might have from a myofunctional therapist standpoint. If they can't tolerate that vibration, like in their palate, I'm curious if their tongue is actually going up there to the roof of their mouth on a routine basis, and they're now overstimulated by that. So I think that an electric toothbrush and a lot of the products that we have in our armamentarium we can kind of double dip sometimes and get some other learn a lot of other things. I do that right now with like the continuous ice suction things that we are using post COVID out there where we put it in there and it holds the tongue back. And if they're like super gaggers, I'm like, let me take a look at some things. Let me do a little airway assessment. Let me see what your Mallampati score is. Like, why are we struggling? Do you have any sleep apnea issues? So I think there's just so much that we can, you'll start to see a trend, I guess, is one point that I would like to make, that if you have a patient that's always like, nope, I can't tolerate that. It makes me gag the moment I put that in my mouth, or the vibration is too much for me. I feel like that's a bigger problem. And that should send red flags off in your head to maybe investigate some other things.
Yeah, that's a great point. I mean, I love those suctioning tools. It just makes, your job as a dental professional so much easier. The tongue is protected, the airway is protected. But you're right. There's so much we can learn from using those types of devices.
I never would have thought 5 years ago, I never would have thought about that. I mean, I still actually didn't think about that, but the things that we've learned doing this podcast has been incredible, and how everything works together. Oh my gosh, I just got chills.
It's so true. It's true. And the things that we once scolded patients for, or got really annoyed with patients about, like maybe all your patients are using an electric toothbrush, and you got these like a handful of patients that are like, I gag, I can't take it. It's and you're just like, come on.
Everyone else can do it. Why can't you?
Everyone else can do it.
Right.
And now for me, it's not, I'm not coming, my perspective is shifted from a place of annoyance and like, come on, your mouth is a mess. It's a train wreck. Can we do something, please, to better your oral health at home? And now I'm going, oh, there is a way bigger problem, and I can be the key to get them the help that they actually need.
You're like a detective. You're like, oh,
it's so true.
We need to get you like a Carmen Sandiego hat.
Yeah. God, I hope that most of our audience gets that reference, but I have a feeling.
Okay, so my kids get it because there's a new cartoon of Carmen Sandiego. That's pretty good.
Oh,
good to know.
So where in the world is she? But don't give Michelle any more power. We don't want her having any more power than she already has.
Now I'm just Detective Strange. That's how I will answer.
All right, let's get back on track, everybody, shall we?
Shall we?
So I wanted to go back to the meta-analysis because I think it's really important for our patients to understand, and dental professionals to understand the research behind our recommendations. So we talked a little bit about the clinical relevance and how the higher up that pyramid we go, the more clinically relevant the information is. So when we take a look at the recent meta-analysis was published, it took a look at oscillation rotation versus manual and oscillation rotation versus sonic. So what this tells us is it tells us, if we make a certain recommendation, a certain type of technology, how the patient will look different when they come back in our chair. Will they look healthier? Will there still be plaque? Will there be a lot of calculus? So one thing we were able to do is we were able to calculate an odds ratio. So since we had access to all the information about each participant, we're able to follow them from beginning to end. And what we're able to do is we're able to measure the association between exposure and outcome. So for example, if you were a smoker, which would be the exposure, you could calculate the odds ratio for likelihood of getting lung cancer. So exposure being smoker, non-smoker, outcome being cancer, no cancer. So we're able to do the same thing with transition to gingival health. So what are the odds that if you use this specific type of technology, you will transition to gingival health? So what they were able to find out from this study is that if they compared oscillation rotation versus manual, you were 7.4 times as likely to transition to a healthy gingival state than if you use a manual toothbrush, which is pretty powerful for just pretty significant. Yeah, for just switching to, an oscillating rotating toothbrushes versus a manual brush.
What's the average length of time that was it like a 3-month follow-up?
I'm not sure exactly because it was like several different studies. So I think most of them range between like 6 to 8 weeks in terms of studies that they were able to follow them. But what they found was that 65% of the people transitioned to a generally healthy state that were using oscillating rotating versus only 20% of manual users. So say you had a room full of 100 patients, 65 would have transitioned to healthy versus a room full of manual users, only 20% would have transitioned to healthy. So pretty big difference.
And I know there's a lot of things we can infer from studies and things like that, but I think one of the things I think I want to talk about a little bit is the technique of teaching and educating our patients on how to use the tools at our disposal, because I feel like one of the benefits is, even if you're not doing it 100% perfectly, generally for a patient that's not healthy, you're going to see some improvement.
Oh, absolutely.
But if we were to really educate them, think about how much more healthy they could be if we were to take the time to do our job properly.
Mm-hmm.
I bet those numbers would go a lot higher.
Oh, absolutely. You know, if there was a way that you could just be in the bathroom with them every day and just show them where they're missing, and, you know, like the classic, like angel devil on the shoulders, if you could just be there being like, you missed a spot, that would be great for every patient. But just educating them on, you know, the power of the different toothbrushes that they can use, the areas that need to be brushed, and the proper technique. You know, when you think about getting like the distals of your second molars, it's so nice to have a smaller round brush head to really get back there and make sure that you're keeping it clean. Because a lot of people don't even realize that they're missing these areas, and they just get missed over and over again. Like I've had patients with calculus bridges, like on the lower anterior, which we've all seen a million of them. And like, they don't realize that that's abnormal or that there's a problem there. I've actually had patients come in saying that they've chipped a tooth when really they just chipped some calculus off of that bridge. So I think that definitely shows like a gap in patient education of like, this is what your teeth should feel like. This is what calculus feels like. And how do we prevent that calculus from forming?
Mm-hmm. And I would agree. I think that a lot of times, you know, radiographically, you can see those distals of those second molars or third molars, depending on what they have in their mouth, but whatever the terminal molar is back there. We've all seen that so many times where not so much interproximal anywhere else, but that spot gets missed a lot. You're right.
Oh, yeah. And it's hard to get back there. I mean, I think people have smaller mouths, or they might have dexterity issues, or they just might not realize that they're missing it.
Mm-hmm. Mm-hmm.
Or the anatomical changes post third molar removal.
Yeah,
Oh, yeah.
That's true too.
That was what I contended with a lot in perio.
Really?
Was the distals of those second molars. And a lot of times it was just an anatomical change, or how it healed, or if they rolled that third molar out of bone, you know, if it was impacted versus not impacted, it really did affect that shape of the jaw bone, or the ramus, or the retromolar pad. So it would make it a little less cleansable, or
sure.
Maybe if they had a little bone loss prior to, or you know, because of that third molar.
Interesting.
Yeah, it would always just
and soft tissue and hard tissue
distal.
both are going to be, because if they,
Absolutely.
you know, over sutured it and it kind of raised up in that one little peak that you see sometimes, or whatever.
Or even as the thirds are coming in, you know, you see a lot of, even for myself, like I had like pericornitis where, you know, the tooth was kind of half in, half out, and tissue was all inflamed. And it's just nice to be able to have a way to like get back there and really clean it.
Mm-hmm. Mm-hmm.
Absolutely. And I had jaw surgery, and the way that the surgical or the incision healed, now it's gone, but for a solid decade, you always had this like bubbled up part, and it always sat right at the gingival margin of my like number 18 or something. And yeah, it was always just a kind of a beast. And I almost always missed that area, even as a hygienist would miss that area.
At least you admit to it.
I'll admit to a lot of things. I also ripped my sutures out because I tried to electric toothbrush too soon. So don't be me in a lot of ways.
Oh man,
for so many ways, not just
in so many ways. But man, you want to get in there and start brushing again, but don't do electric toothbrush before your dentist gives you the
okay.
A-okay.
Oof.
Any other little points we want to make that maybe we can discuss?
I think one of them is that, you know, I think a lot of times we recommend the power brush once they come into the office, but I think there's definitely a benefit of recommending it prior to dental procedures. So, you know, I think a lot of times I would have patients come in and they would need anterior composites, but their tissue was just so unhealthy, you know, that I couldn't get the field dry. So there are a lot of times I've actually had to send patients away for a couple weeks to let things heal and give them, you know, a proper regimen before I could do the actual dental procedure. So there's definitely a benefit of getting them started on the electric toothbrushes, you know, a proper stannous fluoride paste, prior to even starting the dental treatment. Because if you can have a healthier mouth when you start, think of crown preps and anterior composites, or really any dental procedure, you'll have a better field to work in. You'll have less bacteria contaminating the fields, and hopefully an all around better result.
Yeah, for sure.
My brain is like screaming ortho removal.
Yeah. Very true. When you think of like the white spot lesions, and it's hard enough to get 12-year-olds to brush.
Yes. And the bulbous tissue, that's where I started, was in ortho. And man, what was it called? Retention? When we take the ortho off, God, I've forgotten the lingo now. But when you pull the brackets off, like you have to use a drill sometimes to smooth away the glue from the brackets if you didn't pop off super clean. And man, it was like a bloodbath when those 12-year-olds. It was crazy, but I didn't think about that.
Right. And even like for perio probing, sometimes if the tissue is just so red and inflamed and there's so much bleeding on probing, I feel like you can't get, as accurate of numbers that you want, just because you just genuinely can't see.
I'm thinking wouldn't it be interesting if you had a new patient coming to your practice and you kind of on the confirmation calls, the confirmation text, emails, whatever you send out, we're really excited to evaluate your home care instructions or home care regimen before you come in. Or if you are coming for a procedure, we ask that you really up your game so that we can perform that on the day of the new patient.
Absolutely.
Interesting thought.
They do it for all sorts of, medical procedures. It's, 2 weeks before this procedure, you need to, stop taking ibuprofen or do this or whatever the procedure is, that you have to do prior to your procedure. And you're right. I don't see why there's any reason you can't say, okay, welcome to the practice. We're excited to see you. There's lots of great kits out there that contain, a power brush, rinse, floss, and almost as like a new patient welcome, if you could send it to them and say, we would love for you to start using this prior to coming in for your new patient exam. It'd be great for building up a rapport with the patient, and it would really improve their oral hygiene prior to even coming in for that initial exam.
And hopefully set the stage for how important and how critical that is for the long-term success of the dental visits that the patient will have. If it's a new crown or a new implant, ortho, Invisalign, or any of your Ortho FX clear retainers, I mean, it would just really set the stage that this isn't just us doing the procedure, that there is a responsibility and an accountability for the long-term success of keeping their teeth and the restorative work that they have done in their mouth.
Absolutely. So, it's saying, we're all on the same team and we want you to have the best possible outcome. And to have the best possible outcome, you need the tools to do this at home.
Absolutely.
Yeah.
We're on to something. Let's create that as a standard.
Yeah. That would be lovely.
So I'm curious because I think as dental professionals, the electric toothbrush market has grown drastically. And not only are patients a little overwhelmed at that dental aisle at the, local pharmacy, but I think sometimes professionals are I don't know which one to recommend. Do you have any suggestions on that?
Yeah, absolutely. And I completely understand how dental professionals are overwhelmed. I can't even open Instagram without getting ads for all sorts of different types of power brushes. But I think it really goes back to the science. So, for example, with the meta-analysis, they took a look at oscillating, rotating versus sonic. And what they found is that people who used oscillating, rotating toothbrushes were almost twice as likely to transition to a generally healthy state versus those who used a sonic brush. So I think that really shows the power of your recommendation as a dental professional. So instead of just saying, oh, just get a power brush, any power brush, you really know the difference in the efficacy between an oscillating, rotating power brush versus a sonic brush. You know that the patient is more likely to have a better result if they use oscillating, rotating technology. So I think that's pretty powerful, and it shows the power of the recommendation and the clinical relevance for when the patient does come back to your office.
Yeah, that's pretty strong. Stephanie, thank you so much for making time to meet with us today and sharing all that stuff. That was really good.
Thank you so much for having me.
Yeah. If anyone wanted to reach out to you, though, if they had more questions about the things that you were saying, if they wanted to just reach out in any way, what's the best way for that?
They are more than welcome to email me. So my email address is my last name, Gans, so Gans pg.si@pg.com. So feel free to reach out with any questions or comments.
Awesome. Thank you so much.
Thank you.
Thank you.